A very good morning once again, and thank you, Mansi, for the lovely introduction. And yeah, before I really start, I would like during the question and answer session, I would definitely want to come to Christy as well as Kanmani later on. As in the introduction itself, like SAATHII works with partners in all the states that we work with. When I say partners, there are CSO partners as well as there are partners who are the community partners, CBOs who are in the states that we work with. One of the most important one I'm associated with since, more than 8-9 years is Amana, All Manipur Nupi Manbe Association. Santa is already sitting here on the first row. And we have ITA, a trans men-led organization in Manipur. I would like to acknowledge all of them because the work that we have done, the efforts that we have put in all the states that we work with has been with the support of all the community groups that are mentioned here. Nirangal in Chennai, Quirala in Kerala, RRDC, this is a CBO in Odisha, Modern Architecture for Rural India in Hyderabad, Telangana, Sodaran in Chennai, then individually Dr. Samira, who has helped in bringing about a lot of change in medical education, and then the Vikal Women's Group in Gujarat. And of course, my colleagues in SAATHII, Bishwa, and all my other colleagues, Kedarnath, Nivedita, Savannah, and of course, Dr. Ramki, who has been our guide and mentor for all the LGBT-related work that we put in all the states that we work with. So, actually, there is a lot to speak when we say about our work, but being very specific to the panel, I'll be only considering the education part of the efforts that we have put in. So after the coming in of Kausal 2013, NALSA 2014, and the Trans Act 2019, a lot of the strategies, how we work in the state have been changing. So the NALSA, we know that implementation of the NALSA in all the states, it's not fully yet done. On top of that, now the Trans Act has also come in. So we are having when one is not even fully implemented in the states, another act has come in, and it's a challenge to convince the stakeholders who are there, to remind them and of all the recommendations that are there in these acts. So we thought that speaking about education, going to schools, going to colleges is very important. That's what we thought. So in our domain of education, what we did was we tied up with Childline, we tied up with childcare institutes, and then we also tied up with the district education departments. When I say district education department, I think in the system of India, the district education officers are there in all the districts, and they have the power or authority to help us out in conducting meetings in the various schools if we want to, in the blocks or in the district. So we tie up with them because tying up with all these already existing institutes is very important. When we go alone as SAATHII or with the partners, I mean, it's not very welcoming for them. They do not sometimes want to listen, why do you want to bring the issue of transgender or LGBT people? I mean, what is there? Why is it so important? But then when you go through all these existing institutes, we get their support, we get their buy-in, and then we also collaborated with their existing programs or kind of say school education where they go and do, and then we take a slot from them and then try to educate the teachers, try to educate the students separately. So this has helped a lot, and I will be speaking about some of the outcomes later on in my slides. So far, more than 3,900 students has been sensitized. So this we do by going to the schools and colleges. Then more than 1,362 teachers have been sensitized. So this also we try to take the opportunity. For example, in a district, they have the inspectors are there. The DIs are there who take care of, say, 10 schools, 15 schools, depending on the population or the geographic area of the district. So we always try to get into their system. When they are having their own meetings, we go there and then try to speak about the issues. So that has helped us, I think, to some extent, because the government or the system itself is not taking up any initiative on their own. So we push it. We kind of push it through our requests, through our approach, and then we try to do a little bit what we can so far. And then I'm also since it is education, I'm also bringing in a little bit of medical education. And so the psychiatrists and the psychologists, who are very important from the issue of trans people as well as from LGBT people's point of mental health, the psychologists and the clinical psychiatrists. So for them, like, we cannot go back and ask them to go and have a new type of training. So what do is we take the opportunity of the continued medical education. They have it, they usually have it in the annually and all those things. So 2015, 2017, 2021, in select states that we work with, we were able to train few of them. And then we had separate sessions with the faculty and students of NIT Rourkela. This was a significant example in Orissa. And apart from this, the point is not listed here. So when Kanmani started talking about legal education, it is not legal education that we are doing, but when all these acts and verdicts came out, the legal service providers, they were not aware of. Many of them were not aware of this. So like Santa will be, I think she can also add to me more. Like we have taken the legal service providers orientation on these specific acts only, not to like properly train them on a session or a module, but towards this act and what they can do for the community. So that was also one of the approaches that we undertook, but it's not mentioned here. So yeah, NCRT, which we have been talking from the morning. So NCRT curriculum, so this is not the contribution to the writing, it is in the state of Kerala, where like 8 social science and natural science NCRT textbooks were reviewed. In Gujarat, Malayalam and Tamil local languages, it was reviewed by the team of the project that was working towards this review program, and this is one of the approach. So there is an outcome of that, which I will later on show in the coming up slide. Then another approach, as I mentioned earlier, was the stakeholder sensitization. When I say stakeholder here, it is the educationists, the teachers, the students. So Santa, myself, have gone to many schools in Manipur, like both of us together, as well as in other states, like we have been doing the sensitization through the district office that I was talking about, or with the help of Childline. And the issue that we generally talk is we do not get much time here to talk, because the time given to us is at the most 1.5 hours or 1 hour. So very briefly, we try to discuss the issues, how a gender non-conforming child in the school faces, then the self-stigma and the stigma which is being given by the peers as well as the teachers. So those things are discussed, and then the infrastructure development, of course, the toilets and all those. So these issues are talked about during these sensitization meetings, as well as school uniforms, like the uncomfortability when the child wants to go to the school. Like many of the children doesn't want to go to school because of the kind of vibe he or she gets when he or she dresses unnaturally. When we say unnaturally, for them it is like unnatural. For the teachers, for the other peers, it is unnatural. So those things we try to talk about. And then a good outcome of this was like, since Mansi also mentioned I was in one of the violence reduction program, we got many cases from the schools also. When we say cases from the school, it was like one student faces this at home. They do not raise cases which were there in the school, because when we asked during the meetings, they said, no, we do not have any such bully. I mean, we are friendly with them and so on. But then cases that came to us was like, we have a child like this in this class 7, and he is facing a lot of problem at home. So like that. So we try to talk with the parents. There are few cases, very rare cases coming up, but still, to some extent, we are able to provide a little bit of care. And then we talk with the parents if required. So yeah, in 2018, we had a very good opportunity to train NCRT master trainers in Telangana, Hyderabad. And this training was the master trainers training for secondary school teachers for all SC, ST concentrated areas in southern region. And Dr. Ramki, myself, and the team of Telangana we were able to do a proper session for the trainers here. And we met one very important person here who led us to like talking more with the NCRT, advocating more with NCRT to have this inclusion of curriculum. So we were very opportunate that Ramki was there. Like Ramki was leading the team who was writing the content of the material that went into the teachers training module. So these are just glimpses of the teachers training which was done through the District Institute of Diet, District Institute of Education and Training. We have an institute called Diet in all the districts of India. And this approach we have started very recently in 2020 and 2021. We are continuing it in some of the states that we work with. So it's a very recent photograph from Orissa. And this was held just 2 days back. This is also another training which was organized for inclusion of transgender and gender non-conforming children in school education. And 97 head teachers from secondary schools were trained. This was in, I think, in Bhadrak district of Orissa, which was led by Bishwa. Yeah. Yeah, so some of the results, like, which led to, like, after the training and advocacy along with the community partners, some of the outcomes, which I would just like to showcase a little bit. So the NIT sessions, the NIT Rourkela session which we had, so after the session and after follow-up with the officials and the management there, they notified the amendment of the UGC anti-ragging regulations for that particular university. Meaning they re-notified it, they put up in their notice board that this has to be reinforced so that everybody in the university understands that it has to be followed. Then Calicut Medical College, they implemented similarly, one minute, just go back. They also started implementing the UGC anti-ragging policy. And Women's Center in Kerala, it included sexual orientation, gender identity, expression, and sex characteristics in their gender studies course. Then school sensitization that I told you, like it has helped in addressing few issues of gender non-conforming children. Yeah. And another outcome is, of course, the NCRT manual came up, which is very unfortunately again taken down. But again, we had 2 days back the Madras High Court asking the NCRT to come out with a statement before the next hearing. So hopefully, let's see that this gets through and the curriculum is implemented. So we are definitely there to in the field to implement this. If at all it is out and there, we will definitely push hard to get this also being implemented in all the states that we work with. So, like, some of the challenges which are common throughout, there are some challenges which are common throughout. So one mention can be made of the slow pace of attitudinal change, because change will come only when the mindset of the people changes. So the changing of this mindset is very, very slow. And only there are very few rare people whose mindsets are changed and they are helping us out. The outcomes we are seeing is because the mindset of very few are changing. Isn't it? Yeah, so this is like, it's still a challenge and we have to fight for that. We have to see that how we can strategize to get this done. And the policies and programs or the acts and laws which have come out, it is very difficult to be implemented in the field because, you know, the system, the government system, they need an order from the higher up to get it done. For example, even for the school sensitization, it was like when I say it must be seeming that it must be very easy, but how many times Hanta and myself, we had to go to the district officer to get a letter given out to all the schools. So once the letter is there, the headmaster is agreeing happily to do the sensitization. So those kind of structure is there where we just can't leave it out also, because we have to bear with those systems. If we want our things to be done, we have to bear with those systems. So that is how we were trying. And then, for example, even for teachers training, say for example, we want to push forward the teachers training. Even for that, we have to get approvals from the government because they are all government teachers. Private is another side, but for the government, there has to be a proper deputation, government order saying that, okay, this school in this block all the teachers or all the head teachers go for this training. So those things are required. And the backlash of the NCRT. So these are a few of the challenges.